So we've had the international perspective, we've had the UK perspective, and now we're going to have the Scottish perspective, or specifically Glasgow. And we're going to hear from Saket Priyadarshi, who's Associate Medical Director in Greater Glasgow and Clyde Alcohol and Drug Services. He's responsible for the professional leadership of all medical staff and clinical governance of alcohol and drug services in Greater Glasgow and Clyde. He's a member of the City of Glasgow Alcohol Drug Partnership and is involved in research and holds honorary positions at Glasgow Caledonian University and at the University of Glasgow. So I'm delighted to welcome Saket.
Thank you, David. Thank you, Kirsten, Dave Little, and everybody at SDF, not just for inviting me here today, but actually for getting us all together in this room. It's wonderful, really wonderful to see so many familiar faces, colleagues and friends, and meet new colleagues as well who are going to be contributing and doing their best to reduce drug-related deaths in the years ahead. So great to meet you all. Happy to chat to anybody over coffee and lunch later on today. So I am going to talk a little about our progress towards a safer drug consumption facility in Glasgow, a sanctioned safer drug consumption facility, one that's delivered by the health and social care system, one that is delivered in premises that are world class, I hope, one that's delivered by trained staff, and one that's sustainable in terms of both our staffing and in terms of any legal challenges we might experience as we implement and progress. What I'd like to do is just quickly recap the story of why we think a drug consumption facility is important in Glasgow. Tell you about the current situation with relation particularly to drug-related harms, and then bring you up to date as to where we are in the progress and next steps. So this, unfortunately, is a public drug consumption area in Glasgow City. It's in very short distance walk from here, a photo taken not that long ago. And there are a number of these sites in the city. And you can see why using in this environment in a rushed manner with a range of other people sharing equipment often is associated with a whole range of risks and really poor outcomes. And we've been aware of public concerns of businesses about this. We've been aware of a whole range of health problems for people who inject drugs in the city centre. So we've had the Clostridium novi outbreak, the anthrax outbreak, the botulism, as well as the drug-related deaths. We had all that information for a number of years, but it was really in 2015 when we saw a spike in the number of people who were diagnosed with HIV, who were people who were involved in injecting in public places in Glasgow City, that the city developed its first serious proposal for a safer drug consumption facility. The proposal was the result of a formal public health-led health needs assessment that was done in the city, commissioned by our acting Public Health Director at that time, Dr. Amelia Crichton, and it was a health assessment that really triangulated three important bits of evidence. One was what quantitative data did we have and what could we understand from that about people who injected in public places in the Glasgow city centre. Secondly, what were they and people who worked with them in the whole range of services telling us about their problems and their needs. And the third was looking at the international evidence around interventions that have been shown to be effective in similar situations elsewhere in the world. And that health needs assessment gave us a whole range of information about this population, so 400 to 500 people regularly involved in injecting in public places in Glasgow City, 3/4 male, 1/4 female, and the age range, so fitting at that time. And we're talking about 2015, 2016 when we were doing the health needs assessment, very much in keeping with the in apostrophes older drug user population that we had been talking about, the cohort that we had talked about in those times. Other evidence emerged, such as the sites of public injecting, and the most concentrated sites are in the southeast, the yellow quadrant of the city centre, as illustrated on this slide, everywhere moving probably from Royal Exchange Square towards the Trongate area. But you can see that purple tail into the east end of the city, into Gallowgate and Calton. So from that health needs assessment, a couple of, 7 recommendations were made, but 2 of them were specifically around 2 new service developments that were proposed to be piloted in Glasgow City. One was around safer injecting facilities, another was piloting of a heroin-assisted treatment service. And many of you will know that we now have a heroin-assisted treatment service running through the enhanced drug treatment service at Hunter Street, just up the road here. And this is a picture of the service, and you'll see the booths there. Those booths are actually safer injecting sites themselves. And actually, if we were to have a service in Glasgow, it wouldn't look too dissimilar to this in terms of the injecting area. By the way, that's our nurse team leader, Jill, who's turned away for the photo. But obviously, a safer drug consumption facility is more complicated. We were able to deliver heroin-assisted treatment service through no need for changes to any legislation. It just required licensing of the premises, licensing of the doctors involved in prescribing. And I say just, the project managers for the service would absolutely hammer me for that word. It was very complicated, but we had a framework to get it over the line. It's not the case for a safer drug consumption facility. And you'll notice the change in language. So the recommendation was for a safer injecting facility, but we had a large partnership for a short life working group to develop a proposal, and they recommended that we implement a safer drug consumption facility that included smoking of drugs as well as injecting. Part of that was to help people transition from the highest risk drug use to lower risk drug use. But we knew, as Alex has identified, that there were legal issues with this, and I don't need to go over that because Alex has this very well-planned conference, because Alex has just described that for you. We knew there were legal challenges in that for people who use drugs and for staff and the services involved. We also knew that there was dilemma for our police colleagues in how they managed the area around such a site and people coming and going from such a site. And therefore, we built a proposal with our legal advice, and we asked the Lord Advocate in Scotland for the appropriate legal framework, predominantly prosecution waivers that would allow us to deliver this service. And you'll all be aware that in 2017, the Lord Advocate responded to say that he was not minded to support that proposal because of the complexity of the ask and the complexity of the criminal issues identified. And his recommendation was that we ask either for primary legislation change of the Misuse of Drugs Act, or we ask for changes to regulations that might be a less favourable but a pragmatic way of advancing this. And you'll also be aware that this hasn't really progressed very much. So Glasgow City Council, Scottish Government, very strongly supportive of these facilities, and the previous and the current ministers have made a request to the Home Secretary for the appropriate changes, and the UK government has not supported those changes. So unfortunately, for the last 3 or 4 years, there has been an impasse around the situation. Now, in that impasse has not meant that everything has stayed still. So for example, I think in terms of the media, in terms of politicians from a range of party and civic leadership, the Drug Death Task Force as well, being very supportive and campaigning for such facilities. We've seen the change of wording around such facilities. So Alex describes them as overdose prevention sites, and that language has come particularly from North America and from Canada as a way of helping civic leaders and politicians understand the purpose and to communicate to the public as well. And we've seen the unsanctioned drug consumption room that Alex described and that Peter Crykent ran in Glasgow City. So there's been a lot going on, and unfortunately, though, there's also been a lot going on for people who use drugs in the city centre, and most of it is not very good. So drug-related deaths in Glasgow City continue to rise. The 2001 data showed us, unfortunately, having another small increase. The HIV rates, the original basis of our argument for a drug consumption facility, the HIV prevalence in the population of people who inject drugs in Glasgow City rose really significantly in the intervening years. This is a very busy slide, but just focus on the last two lines. There continue to be a very high number of people who use the injecting equipment provision in the Glasgow city centre. This is just the city centre. So in July, there were more than 1,400 transactions by 448 unique individuals. So we know that that risk population continues to exist in the city centre. And when we ask them more detailed questions through our AIR tool, that's assessment of injecting risk tool, between September 2020 and August 2021, 44% of the people asked, that's 365 individuals, said they were injecting away from home. So we're trying to, John Campbell, my colleague, as many of you will know, is trying to support me in changing my language here away from public injectors. Again, quite a stigmatizing term, we think, into a term perhaps less stigmatizing around injecting away from home. And you can see that sites, public injecting sites, continue to exist in Glasgow City, one taken just in July this year. And you wouldn't have to walk very far from here to find a site like this. So the need is still there. Now, we've not just waited for a drug consumption facility to come through to try and support people. We've implemented a crisis outreach service which responds to near fatal overdoses, which has seen more than 800 individuals in its first year and supported them back to re-engage or engage for the first time with support services. We've changed from a lot of our prescribing from methadone to Buvidal, so more than 500, approaching 1,000 people on injectable Buvidal. We have a WAND initiative, which is wound management, assessment of injecting risk, naloxone, dry blood spot testing for people who inject in the city centre as well, which has been really positive and really helped us change behaviour there as well. And actually, over the last 3 or 4 quarters, we've started to see very significant reductions in the number of people who are suspected to have died of drug-related deaths. And I expect and I hope that 2022 figures will be substantially better than 2021. But undoubtedly, there's a large population involved in very high-risk behaviours who would benefit from a drug consumption facility for the reasons and the evidence base that Alex explained to you. So we were actually really pleased in November last year when the new Lord Advocate Dorothy Bain announced in Parliament that she would look at a fresh and new and specific proposal for a drug consumption facility. And we were delighted to be asked by Scottish Government to work with them, with National Police Scotland colleagues and with the Crown Office to develop a new proposal that might be presented to the Lord Advocate. And the Minister this morning stole my thunder. So she basically told you what I'm about to tell you. This was her statement in June 22 to Parliament, and I'm going to read it, and I'm just going to explain some of what is meant in this. So I have been clear before that we would support work to try and make these facilities available within the constraints and limits of the currently reserved drugs law. So Alex, that means we're not looking for regulations because we're not going to get them. We're not looking for changes to the Misuse of Drugs Act. But a lot of that then means that in terms of the delivery of the service, we as providers have to be very careful about what mitigations we have in place to ensure that they aren't breaches of those, of the Misuse of Drugs Act and criminal law. But it also means that we still need some protection for people in possession when they come into the office, or come into such a facility. Glasgow HSCP have been developing such a proposal for some time, and they have engaged extensively, and she thanks us for their work. Following detailed partnership working between the Scottish Government, Glasgow HSCP, Police Scotland and Crown Office, a new service specification has been developed and shared with the Crown Office. So I'm not at liberty to describe too much in detail the new service specification, because once we have some legal framework around that, we can take that through our systems and it'll be public fairly quickly. But just to say, I think the couple of changes from our initial proposal are that we are not going to include smoking, unfortunately, initially. Believe it or not, from a legal point of view, it's harder to progress that than the injecting element. Secondly, it's probably going to be smaller in terms of size than our initial one, certainly the pilot. And thirdly, it's going to be probably even more connected to the wider health and social care services delivered in the city than our initial proposal. So we are now waiting for a response from the Lord Advocate and Crown Office. And I hope I don't have to give this presentation to you in 2023. I hope that I'll be able to present some sort of figures similar to what Alex described earlier. I'd like to conclude by thanking you for your interest, for your support. I know there's a huge amount of support amongst many of you for this, but also just to acknowledge the whole range of colleagues who've participated in the work and helped me with the slides today. Thanks very much.